Yes, we can hear you.
Yes, I have just finished. I don't know if I was audible enough. I noticed that I was logged out at some point. I don't even know where I stopped. Hello?
Yes, we're talking about the new guideline.
Okay, that was where I was logged out.
Yes.
Okay. Yes, so there is nothing much on that for now. As I said, it has elements mostly of the traditional method of antenatal care, which they are still test running anyway, in different countries. But for Africa, I think we are still largely using the traditional method of antenatal care. So I think that's where I stopped for now. So if there are any questions, I'll take them.
Okay, and doctor, I have a question.
Yes.
You made mention of some errors during the first semester, second semester, first trimester, second trimester, and then third trimester. And we've been told that ultrasound is the best method of detecting pregnancy. Since there are errors in the first trimester and the second and third trimester, why are they still using it?
Okay. All right. Thank you very much for that. Usually, almost like there is almost nothing without error, but it's usually the margin of error that we look at. So for a first trimester ultrasound scan, if you are given a first trimester ultrasound scan, the error margin is in the best hands is around 3 days. So if, for instance, you are a woman is about 7 weeks, so you expect that the highest that woman would be is 7 weeks and 3 days. Do you understand? It's usually a plus or minus, or 3 days the other way. So, however, as the pregnancy advances, like in the second and the third trimester, the scan becomes less and less reliable. A third trimester ultrasound scan is the least reliable scan, because it can give you an error, as in it can give you an error margin up to 3 weeks. So, however, if a woman has no other way of reliably dating her pregnancy, an ultrasound scan, is usually used to date. However, if she has a scan that she did in the first trimester, with an error margin of that magnitude, is not significant. So a first trimester ultrasound scan is usually considered the best dating scan, because most women will tell you that they know their period, but a number of women, it's been seen that up to 70 to 80% of women, that the last menstrual period they give you is usually incorrect, except those ones that follow an app on their phones and then probably use that to remember. But those that don't use it to remember, you know can hardly give you an accurate gestational age. So that is why it is recommended that once you see a woman, especially in the first trimester, the scan at that point can be very accurate. So basically, that's just what that says. But there are error margins, just for you to know.
Okay, thank you, doctor. And one more question. The WHO recommended visits, antenatal care visits. Which are we to pick if there is option of 12 and there is option of 9? Because I've seen where they wrote minimum of 9, and today you are saying something like 4 visits each in every trimester. So
No,
which are we
no.
going to pick?
Okay, what I said is that WHO, that a woman has had, I've forgotten the way we put it. The woman has had antenatal care. She should have had at least 4 visits. You understand? But what is recommended right now, you understand, is still that 4 visits. At least 4 visits in each of the trimester should have been seen, including when she's at term, by a skilled practitioner. But in the traditional care, a woman can have up to 12 visits. And, it's even in that traditional care that a woman should have at least 4 visits. So if you see those, depending on how the question is framed, the correct answer is usually that the woman that has had at least 4 visits has had antenatal care. Do you understand what I'm trying to point out?
Yes, doctor.
So if a woman has had at least 4 visits, she has had an antenatal care. There's a way they usually frame it actually. So at least four
Okay, what
visits.
about in the case of syphilis? Are they to treat or they keep it pending till after delivery?
No, you treat the woman, and then because the problem is that syphilis has some effects on the baby, so it's always good to know. That's why it's still one of the things that we do here in Nigeria. So it's good to know. You treat the woman, and then when the baby is born, so that we can watch out for congenital syphilis and then treat the baby as well. Of course, the what is used in treatment of syphilis is still very safe in pregnancy. That is penicillin, and still very safe in the unit. So you treat the woman, and then when the baby is born, you know, you treat the baby. However, the problem is that syphilis can cause a host of congenital anomalies in the babies. So that will still require a neonatologist, to still treat that baby because of all the congenital anomalies that can occur.
Okay, thank you, doctor.
So I hope that with
Hello.
time we should be able to. Sorry, I hope with time we'll be able to, delve into some of these medical conditions, and then probably some of these things I've just mentioned on the sideline. We can further them. I've asked Dr. Isaac to just give me, you guys, if the MDCN has any, how do I put it, schedule or curriculum for you guys. I can just probably make things from there so that we can at least be able to touch everything before your exams, at least on the O and G aspect.
Hello, sir.
Yes,
Eh,
yes,
Yes, I want to ask about the parity. You were saying that the present pregnancy, even if it has passed 28 weeks, cannot be counted. Like, I
yes.
need you to throw more light on it.
Okay, so parity is pregnancies that you already have outcome. It's not the pregnancy that you're carrying, you don't have an outcome yet, so it can't be a parity. So parity is usually the fact that the woman has at least delivered. Now there are a few catches in this parity stuff. Now recently, even Nigeria has adopted this. If a woman gives birth at less than 28 weeks and the baby is alive, shows signs of life, you may count that baby as parity. Do you get? In the lecture, what I said was that until the baby has passed 28, until the pregnancy has passed 28 weeks before you count it as parity. But what is being said now is that if the baby had showed sign of life at birth, even though the baby is less than 28 weeks, you can still count it as parity. And it's also good to know that this age of viability we are using in Nigeria, 28 weeks, it's far different from what is being used in fact, the WHO right now uses 20 weeks, which follows what the Americans are using. In the British, it was, I don't know, I think they have a new revision, but it was 24 weeks before. So, and what WHO actually uses is 500 grams. 500 grams at 28 weeks, you expect that the baby is 1 gram. I'm sorry, 1 kilogram. So 500 grams, you can see tallies towards around that 20, 22 weeks. So basically, and then the second trick about parity is that any pregnancy that a woman carried that was twin or triplet gestation, you count it as one parity. When you're counting the parity, you count it as one. The only way where the twins would appear, even in the gravidity, you count it as one. The only place where it would change, where it would appear, will be in the number of living babies. So, for instance, a woman that has 3 children and then the one of them was twin will be counted as para two. Meanwhile, he will have 3 children alive. So, are we together? So that's just some of the catches when it comes to that parity question.
Okay, thank you, sir.
All right. So I'm still waiting for more questions.
Okay, thank you very much for the wonderful lecture, Chifu Bongo. I appreciate you. And please, can we just thank him individually? Let's thank him before we tell him, well, bye bye.
Thank you
All right.
very much,
Thank you, guys.
doctor. Thank you very much.
Thank you, doctor.
Thank you,
Thank you,
doctor.
doctor.
All right.
Okay, Chifu Bongo, we appreciate you so much for today's lecture. Thank you very much. We today we will not be having any other lecture again, even though I'd have wished to give you surgery lecture, or we may shift it to either during the week or this weekend. So from my end, we wish you wonderful week ahead. Again, one thing again, I want to encourage that please read your book, watch your YouTube videos, revise past questions, and I can guarantee you're not going to fail. You're going to pass the examination. Again, read your book, watch YouTube videos, revise past questions, MCQ past questions, and if you do this, you are sure on your way to success. Once more, good evening and bye from us here.
Goodbye, sir.
Right.
Thank you.